Hello, everybody. My name is Siobhan Midgley. I am a certified vision rehab therapist, as well as a teacher of the visually impaired and an orientation and mobility therapist. I'm based out of the Chicago area, and I am presenting today on Charles Bonnet syndrome. The title of this presentation on the screen is Charles Bonnet syndrome, CBS for short, and why we should know about it. The image description is a person that is driving in a car, and they're looking out the windshield, and there are two dogs sitting in the road. So a little bit of background about myself, kind of why I am doing these presentations on Charles Bonnet syndrome, is I kind of started learning about Charles Bonnet as an undergrad. I studied neuroscience, that's my bachelor's degree. And when learning about the visual system, there was this syndrome that came up, and I didn't know a lot about it. It was very quick, heard about it, and then we moved on to some more material. And I always found the visual system to be interesting. And, that kind of spurred me to get into the vision field. And Charles Bonnet syndrome is kind of an interesting marriage of the vision field and neuroscience. And as I became more versed in the vision field practice, I realized that I was seeing people that I thought might have Charles Bonnet syndrome. And now I have to put in my disclaimer. I am not a doctor, and we will talk more about how to discuss this with clients, how to kind of try and figure out what's going on, what the doctor's appointment would look like. But I was hearing my clients tell me, for example, one client asked me, have you ever heard of somebody who sees things? Very general. And I kind of probed and asked what he was talking about. And he said, when I sit on my front porch, and by the way, this man had been blind for maybe 5 years at that point. He was an older adult. And he said, when I sit in my chair and I look out at my front lawn, I see these really this really tall grass blowing in the wind. I live in the city. I live in Chicago, so I know that it is not actually really tall growing fields of grass out in front of me. And I asked him, have you ever heard of something called Charles Bonnet syndrome? And he said, actually, I've spoken about it with my doctor. And that was kind of one of the big aha moments where I was thinking, maybe we need to be talking about this more, because I'm seeing it a lot more in my few years of experience than I would have ever expected. So in this presentation, we're going to be talking about the background on Charles Bonnet syndrome, how it manifests, coping skills for those with it, and also resources, and talking about some further research and therapy if that is something that a client is interested in. So who was Charles Bonnet? Where does the name Charles Bonnet syndrome come from? Charles Bonnet was an 18th century Swiss naturalist and philosopher. He was the first to document his grandfather's hallucinations in 1760. So while CBS has probably been around since the dawn of man, he was the first to document it. So he writes that his father was seeing people, birds, carriages, buildings, and his grandfather had cataracts at the time. Eventually, in Charles's old age, he experienced CBS as well, and it was then named after him in 1937. So why should we know about CBS as vision specialists? Well, there's a couple reasons. For one, the studies that are coming out and all of the studies that I reference in here, you can reference those at the end of the PowerPoint. I have links to those, but the prevalence of CBS has been underreported and undiagnosed due to mental health stigmas. I mean, imagine that you are not only going through vision loss, but now you're seeing things that other people aren't seeing. And it can be very isolating to say, hey, I just saw, you'll see we have an example of a spaghetti bowl sitting on the table. And somebody says, no, there's no spaghetti bowl sitting on the table. It can be isolating, and there is fear that it is due to a type of dementia, and people don't talk about it. I had one client who brought it up with a family member, and that was the first time they brought it up, and that was the last time they brought it up, because it was not well received. The Canadian National Institute for the Blind study says that visual hallucinations are experienced by approximately 1 in 5 patients with vision loss caused by an eye disease. And this was a study done in 2016, and that as the body of research gets larger and larger, we are seeing that this is much more prevalent than we previously thought. Specifically, the Royal National Institute for the Blind stated a 67% increase in hotline calls with reports about hallucinations from January of 2020 to January of 2021. And we know that during that time, COVID restrictions were incredibly high. The RNIB says that there is most likely a correlation between the anxiety of COVID, the lack of stimulation because we all had to stay inside, that probably caused this increase in hallucination hotline calls. So we as vision specialists are in a unique position to be able to educate our clients about Charles Bonnet syndrome. And I really do feel that it is our duty to make sure that people know, because oftentimes even ophthalmologists and optometrists don't know about it. In the research world, the research is more coming out on the neurological side. That's who is studying it, as opposed to vision professionals. And so that kind of has led to a gap in vision professionals knowing how to discuss and even knowing what Charles Bonnet syndrome is in the first place. So what is Charles Bonnet syndrome? Now, there is no standard diagnostic criteria that we have. Like I said, the body of research is small, but it is growing, and we don't have a lot to base our any diagnostic criteria off of right now. But this is kind of, these 4 points can help narrow it down a little bit. So the first would be recurrent visual hallucinations in a patient with a known ocular disease. And that part of patient with a known ocular disease is important because, for example, there is a body of research showing that Parkinson's patients often have visual hallucinations as well, and they look similar to Charles Bonnet syndrome hallucinations. And so there may be a common kind of neurologic pathway that is used by both of these visual hallucinations, but we still would characterize CBS as with a patient with a known ocular disease. The second would be knowledge that the hallucination is not real. In my next slide, we'll kind of talk about the difference in terminology. The word hallucination can be jarring, and it is not the word that I usually start out with using. I'll give my kind of elevator spiel that I use when I am first broaching the topic of Charles Bonnet syndrome. But in general, the client should know that whatever they are seeing is not real life. The third would be no concurrent cognitive, psychiatric, or neurologic diseases. And we'll talk a little bit about what it would look like going to a doctor's visit and talking to your doctor about CBS. And the fourth is no other sensory modalities. So the only sensory modality they should be experiencing is visual imagery. You don't smell anything, you don't feel anything, no one's touching you, you're not touching them, and no taste. So let's talk about the difference between hallucinations, illusions, delusions. It is my philosophy that knowledge helps my clients to not be fearful. And so if we can understand the terminology behind Charles Bonnet syndrome and behind their eye disease or whatever it may be, then we can help them to not be so fearful. And the term hallucination is a big word, and we hear it in a lot of scary instances. So let's kind of break down the difference between these different terms. So a hallucination is perceiving an external object as truly there when it isn't. So for example, the client sees a bowl of spaghetti on the table, but there actually isn't one. Now, then you have an illusion. So that would be seeing real things incorrectly. For example, a bowl of spaghetti is misinterpreted as a bowl of worms. And then you have a delusion. It's a false or erroneous belief involving a misinterpretation or perception of experiences. So you think that that bowl of spaghetti that is sitting on the table is actually all those spaghetti noodles are trying to strangle you. So it's important to kind of break down what Charles Bonnet syndrome is and isn't. We consider some in the research field on CBS call it a pseudo hallucination. But what you are perceiving an external object, you know that it is not real. It might maybe take a little bit, especially if Charles Bonnet is something that you don't know about, or you are recently experiencing visual hallucinations. It might take a little bit of time to figure out, oh, this isn't real, but we still do consider it a hallucination. So let's talk about the different types of hallucinations. We break up Charles Bonnet syndrome into two different types, simple and complex. So a simple hallucination would be unformed repeated patterns like grids, shapes, lines, colored blobs, flashing lights, or orbs. I've had clients who see flashing lights that almost look like fireworks going off in their vision. I have another client who sees like a zebra pattern that kind of floats through her vision. Then there are also complex hallucinations. So Charles Bonnet's grandfather was having complex hallucinations. So those were recognizable shapes, people, animals, environments, buildings. My client that I talked about in the beginning was having a complex hallucination of grass, fields of growing grass outside his front door. The pictures that I show here on the left is of a woman with her eyes closed and a black background, and she has these light orbs kind of flying around her. And the picture on the right would be a couch, and superimposed on that couch are wildflowers. There is some overlap on some common themes on what people see. Oftentimes distorted faces or cartoon-like people or characters or animals, as well as people dressed in Victorian era clothes. There's not a lot of research to kind of figure out why and how people are seeing like these very kind of specific hallucinations, but that is something that would be really interesting to research down the line as we learn more. So let's talk about some characteristics of Charles Bonnet syndrome. So it occurs usually in, well, always occurs in the adventitiously blind. In order to have Charles Bonnet syndrome, in order to have visual hallucinations, you do have had to have some type of visual memory. It doesn't necessarily have to be, full visual scenes and people, but even light perception. Now most of the studies are done on older adults just because that is the population that we see with the most visual impairment. But there are emerging studies on children with CBS showing that it's possible. Young adults, kids, eight and up. While we just don't have enough research on it right now, it is looking more like there is a prevalence in younger people as well. Now, these hallucinations, they may cover your visual field. They could occur in just one spot, like one hemisphere of your vision, or they may float across. They can come on gradually or suddenly. There does seem to be some correlation between how quickly you are losing your vision and the onset of CBS, that the more quickly you lose your vision, the more likely CBS can occur. But the moments in time and frequency vary. So what I tell my clients is that you need to get to know your hallucinations. What are some common themes you're seeing? And we'll talk a little bit more about that when we talk about coping skills. So these hallucinations can last for days, months, years, but they often diminish as vision decreases. So one study reported that 60% of subjects reported hallucinations had subsided after 18 months. So, as I kind of move through these characteristics, it's very clear that we haven't quite narrowed down exactly who will be getting, who is more likely to get CBS. As I've said, the research is still growing and we'll still have a lot to learn, but this is kind of a good starting point. Demographic wise, really, CBS has only been studied in European and other English speaking countries. So it is mostly researched in the white population, but there are some studies on the Asian population, and that research is saying that it is not anything really substantial, but a lower prevalence in the Asian population. The difficulty with this research study in particular, and in general with Charles Bonnet syndrome research, is it is difficult to pin down the definition of Charles Bonnet syndrome. So for example, in the Asian studies, there has been some conjecture because they have a very rigid definition of CBS, and some say that doesn't incorporate some people that are being left out. So we're still learning at the end of the day. There can be triggers. So for example, we talked about with COVID restrictions and COVID lockdowns, that sensory reduction, social or physical isolation can lead to stronger visual hallucinations or the impetus of visual hallucinations. The level of illumination can be important, and we'll talk a little bit more about that with coping skills. States of drowsiness or relaxation. So if you imagine that Charles Bonnet syndrome is an overactivity of the visual pathways in the brain, your brain wants something to do, right? It wants some stimulation. And so when it is in that kind of drowsy or relaxed state, it's almost like you're daydreaming. Your brain is daydreaming. And that can lead to visual hallucinations. We also discussed the rate of vision loss. The faster you lose your vision loss, there does seem to be a correlation to the onset of CBS, fatigue, stress, as well as contrast sensitivity. So these are some CBS screening questions. Now, the first thing that I'm doing with my client is obviously building rapport. I am going through the general vision rehab therapy assessment that I do, or orientation and mobility, whatever it is, right? And as I am gaining trust, as I am learning about my client, they're learning about me, and we are gaining more trust, towards the end is when I feel most comfortable bringing up Charles Bonnet. And I give my elevator spiel. I want to first tell people about Charles Bonnet, as opposed to asking them, hey, do you have visual hallucinations? That can be a bit jarring. And I'm explaining kind of what it is, how it affects the visually impaired population. And then I'm moving into these more screening questions to prompt them. So the first one being, have you ever had any unusual visual experiences? You keep it really vague. You're not using the term hallucination. You don't want them to feel alienated. If they say, no, I haven't, then you can move to question 2. So have you ever seen objects or things in your vision that you know aren't real? If they're saying no, then that's like, okay, that's fine. If you ever do experience this, feel free to let me know, let your doctor know. And this is because there is a known syndrome called Charles Bonnet syndrome that often does affect the visually impaired community. And I want you to know about it. Now, if they do say, yes, I have had visual experiences that I can't really explain, I know they're not real, there is a series of questions to kind of probe and get a little more information. What objects or images are you seeing? How long have they been present? How often do they occur? How long do they last? Are they moving? Are they colored? Do they make noises or sounds? And specifically, a couple of these that we'll get into, one that I just mentioned, are to kind of probe whether this is a CBS hallucination, or might there be other underlying mechanisms for why they are hallucinating. Because as I said in the beginning, you should not be feeling things, hearing noises or sounds. So if you are asking, do these visual experiences, do they make any noises or sounds? Are you aware that they are not real? Is there anything you can do to make the visions appear or disappear? Do they upset you? Have you told anyone? Do they interact with you? So you have a lot of questions that are probing, could this be Charles Bonnet syndrome? Could this be something else that they need to go speak with their doctor with about? An important question in there is, do they upset you? And have you told anyone? So that's kind of probing their mental health surrounding what they're seeing. Do you have somebody to speak with? Do you need additional support and resources? Is this something that is affecting your day-to-day life? So let's talk about some of the different treatment options. Now, the first one would be improving vision through low vision aids, something we pretty much do already as low vision therapists and vision rehab therapists. But Because in Charles Bonnet syndrome, the brain is craving stimulation, improving the low vision can help to give the brain that stimulation that it wants, therefore calming visual hallucinations. We all know that that's not always the case, that we can provide low vision aids that will improve vision. And so we can look to non-pharmacological as well as pharmacological treatments for Charles Bonnet syndrome, which we will talk more about. Let's talk about non-pharmacological treatments first. Now, these are, especially considering I am not a doctor, these are kind of coping skills that I feel comfortable speaking to my clients with Charles Bonnet syndrome about, and then we'll kind of move into what it would look like if you do want to speak with a doctor about Charles Bonnet syndrome. So the first one I always recommend is improve your lighting conditions. So for example, one of my clients she noticed that her kitchen was kind of dimly lit, and she was often experiencing these kind of light orbs, while she was in her kitchen in a dimly lit area. And then when she would go into other rooms or outside in more well-lit areas of her home, those hallucinations were not as strong or frequent. So improving lighting conditions can help to reduce these hallucinations. That goes back again to low vision aids and having a solid low vision assessment to make sure that lighting conditions in your home or wherever, or your job or whatever it is, are good, and any other low vision aids that you may need. The other one we can talk about is the windshield wiper method. Now, this method comes from a study, and it gives this method of helping to, well, let me say, I need to say that the windshield wiper method, I coined that term. That part did not come from the study, but I think it's a apropos term for it, and it helps people to kind of remember what to do. So you're going to stand about 5 feet away from a blank wall, and you're going to imagine 2 points about 3 feet apart. Doesn't have to be super specific, but 2 points. You're going to keep your head still. You're only moving your eyes, and you're looking from one point to the other once every second or two, about 15-30 seconds, just back and forth, kind of like a windshield wiper. Have a break for a few seconds, and then you want to repeat this cycle 4 or 5 times. So you can think of it kind of when you're wiping those hallucinations away. You're focusing on something, even if it is, you can't focus very well on these imaginary points. It's exercising your brain and your visual pathways. These other coping skills are also along that similar track. You can stare at the image and blink repeatedly. Try reaching out to touch the object. Try moving around or completing a task. If your brain is kind of in that relaxed state, you want to give your brain something to do, something to take up some of those pathways that are just kind of dormant, and allowing visual hallucinations to kind of pop up. Of course, because of most syndromes and diseases we talk about, minimizing stress can help. A healthy diet and exercise can also help to minimize Charles Bonnet syndrome hallucinations. Usually, these hallucinations should not be bothersome. Maybe they're a nuisance every once in a while, but oftentimes people with Charles Bonnet are able to cope with them. You learn about what your triggers are, you learn that these are not real, and you can continue on your, doing your daily activities. when these hallucinations become scary, if they are scary, I know one client who was having them 24/7. If they're interfering with your normal life and your day-to-day activities, if there are other senses involved, if they seem too realistic, these are all reasons why speaking to a doctor may be the next best move. And I do explain that you should be able to cope with these. If you are not, then let's look at resources, speaking with doctors, getting into a support group, which I'll talk about in a minute, and let's get you some more help. So if I have a client who wants to speak with their doctor about it, it is important for me to walk through with them about what they might expect at the doctor's visit. I have had instances where a client told me, yeah, I'm seeing these things. And then I went to the doctor and they said, well, we have to rule out Alzheimer's. And they shut down, the client shut down, and they have not been back since. And it didn't go very well. And so educating our clients on what the kind of medical process is to decide whether or not it's Charles Bonnet syndrome can really help them to help allay some of those fears going into the doctor's office. So there's going to be a cognitive evaluation because, well, Charles Bonnet syndrome is a syndrome that you have to rule out other diseases and syndromes. It doesn't mean you're more susceptible to any of these, like dementia or Alzheimer's, but they do have to rule out other things. And then they can say, we think this is Charles Bonnet syndrome. So that cognitive evaluation is going to rule out other syndromes and diseases. Same with the psychiatric workup and the neurology screening. Then there's also going to be metabolic causes that they want to make sure is not causing these hallucinations. So for example, they'll take blood labs because a vitamin B deficiency can cause hallucinations, right? Because hallucinations is seen in so many different syndromes and diseases, we have to make sure that there's not other things causing those hallucinations. For example, medication can cause hallucinations. So they will take a very thorough history of what medications you are on and have received. And then we can talk about treatment options. Now, because visual hallucinations, regardless of whether, like we talked about, Parkinson's or schizophrenia, because these all do have some similarities in the hallucinations that are being seen, antipsychotics can be a treatment option. Now that comes with its own plethora of side effects, but the last thing that I want when my client is going into the doctor is being extremely caught off guard if the term antipsychotic is brought up. So that's why we're running through these, what are you going to expect? And explaining why this is all to benefit their health and well-being. Okay, so these are some resources that I have compiled for vision specialists as well as for clients. The first one that I have up is the American Society of Retina Specialists overview sheet to bring to a doctor's visit. And this sheet is, like I said, because it is still, Charles Bonnet syndrome is still a syndrome that is being newly studied and there's more coming out. It is not always well known. And so bringing this with you to a doctor's visit and explaining, this is what I think I might be experiencing. What do you think? Can be really helpful for both you and the doctor. And I didn't mention this, but all of these will be on the OIB-TAC website in a resource document. The next one I have is Dr. Gary Cusick's website. He is a clinical psychologist based out of Kentucky, and he's been doing research on this for many years, and he has a support group that I actually do have a couple clients who, it is a virtual support group. And I have some clients that do attend, and they have gotten a lot of benefit out of it, out of sharing stories and learning about other people's experiences. The next link that I have is Understanding Charles Bonnet Syndrome. It is a more comprehensive document on what Charles Bonnet Syndrome is, what you can expect. And then I also have the Royal National Institute of the Blind link to their website. They have good info on Charles Bonnet Syndrome, as well as Esme's Umbrella, which is a nonprofit organization who also provides learning and research and tools on Charles Bonnet Syndrome. I have links to the different research articles that I have used as well, if you are interested in learning more about the research going on with Charles Bonnet Syndrome. And if there is any follow-up questions, please feel free to email me at smidgley@ffvs.org. Again, that is S-M like Mary, I-D like dog, G like girl, L-E-Y at F like Frank, F like Frank, V like Victor, S.org. My number is 773-340-2059. I'm happy to discuss Charles Bonnet Syndrome with you if you need further resources, whether that is from the vision professional perspective or from a client perspective. Thank you.